ABC Action News with Linda Hurtado, Wendy Ryan, and Dennis Phillips with your AccuWeather forecast.
It's called the silent killer. Abdominal aortic aneurysm often presents with no symptoms, but if it ruptures, it can kill you in 20 minutes. Tonight, am I taking action for your health report? I'll tell you what doctors at Morton Plant Hospital in Clearwater are doing to save lives without putting patients through major surgery. 82-year-old Bob Lapin is lucky to be alive. He came back to Morton Plant Hospital in Clearwater to talk about the silent killer that almost got him.
I have a very bad back.
Images like these, taken to diagnose his back pain, uncovered an abdominal aortic aneurysm, also called a AAA.
The aneurysm is basically, it's a weakening of the aortic wall, and in this one, it's like a pregnant belly here.
Bob knew if left untreated, the aneurysm could kill him.
I had a friend who had died because he had an aneurysm and it had burst. So I was not going to put off getting this thing fixed.
Fixing this type of problem once required invasive surgery. Dr. Mitchell Weiss is part of a team at Morton Plant that started to use a stent and a few small incisions to save patients like Bob.
This is that device.
Through a small groin incision, the doctor inserts this stent into the aorta. The stent reinforces the aortic wall and...
Believe it or not, 2 weeks afterwards, I was whitewater rafting in Idaho with my grandchildren.
So it's a far cry from, when things started, patients that had open surgery were in the intensive care unit for a couple days afterwards, and then were in the hospital probably for, a week to 2 weeks.
While doctors don't know exactly what causes an abdominal aortic aneurysm, they do say these folks are at higher risk. Anyone who is over 50, people who smoke, those who have high blood pressure or a family history, and men are 5 to 10 times more likely to develop a AAA than women.
You're the guy that saved my life.
Bob is now an advocate of AAA screening.
You really don't have any feeling of an abnormality at all. I personally believe that anyone over the age of 60 should have one done at least once every 2 years, to be honest with you. And that's both men and women.
AAA screenings aren't usually covered by insurance. However, Dr. Weiss says an MRI screening is covered in your initial enrollment in Medicare. And if you have a family history, it is more likely that your physician will be able to get that test approved. If you'd like